Hello again. My name is Rosemary Anachabe. This is the part 2 of the Integrative Therapy video. So as I was talking to my client about meeting family legacy, that seems to be a stressor. We have to figure out ways to avoid making it a stressor so that you can live a normal life and live an accomplished life which you have done so far without having to feel that you're obligated to a certain expectation. It sounds like you're trying to meet an expectation. Am I correct?
Yes.
Well, the goal of the therapy today is let's work on ways to avoid feeling that stress of wanting to meet a certain expectation so that we can live a normal lifestyle without having so much trouble.
Okay.
So, healthy coping. Healthy coping is when you deal with stressors in ways that will help you decrease stress without harming yourself or other people. Signs of healthy coping, positive ways to deal with stress. Talking about how you feel is very important. Exercising, seeking out family and friends for support and help. Writing your thoughts and feelings in a journal. Turning a negative thought in response to a stressor into a positive one. Using a positive self-talk. For example, I am feeling calm. I can do anything I set out to do. Doing relaxation techniques. We will finish today's session with one technique called abdominal breathing.
Okay.
Abdominal breathing is very good, where you use your abdomen to breathe. You breathe in and hold, and then breathe out. Can you do that for me?
Yes, I could give it a try.
Very good. Taking small steps when you are first working towards your goal or trying something new. For interpersonal psychotherapy, the information here we're working with is the fact that you have a history of anxiety and depression. It's the fact that you have previous history of a failed marriage and you're concerned about your current marriage and you don't want it to go the same route. You also have this concern of feeling like a failure, which in my opinion, I don't see why, because you're very successful. And also the stress of wanting to meet up to family legacy. So for guidance, it's okay to tell your family and friends how you feel. And I want to reassure you that when you tell them, it doesn't mean that they will judge you or that they will see you as a bad person. It's always important to discuss your feelings so that you don't hold so much in. For clarification, I think you said something about meeting up to the family expectation. Am I correct?
Yes.
So for communication skill education, it would be nice if you tell your family in a calm and open environment how you feel and allow them to ask questions and be open to answering questions. Behavioral techniques could include trying to change negative behavior to positive behavior, being positive when you address your family, environment management. Well, a good one would be to give your guns to your brother to keep. That way you don't have outbursts of anger or do something you regret later on. Does that sound like a plan?
Yes, you can work it out.
For supportive therapy, identify 2 or 3 coping strategies that may be helpful for you to clarify if the strategies will be consistent with the personality and lifestyle. So, what are 2 strategies that could help? For me, I recommend group therapy, community and family support, meditation, and things like yoga. They can help in supportive therapy. You can create a list of these coping strategies, giving one to your patient and other to in his medical record. Have the patient keep track of both the problems and coping strategies that occur over the next weeks or couple of weeks. Have a patient bring a summary to the next office visit. Assess coping strategies the patient used, reinforcing strategies that are effective, and making suggestions when improvements are needed. So for supportive therapy, there, like I said, we can do group therapy. There's community support. Relationship history is very important, so we want to see how we can turn things from negative to positive. And patterns of relationship in terms of cognitive, how do you feel about your wife, your current wife, and what are the ways to relate to her in such a way that you can get a positive outcome. Also, you mentioned in the past that you have persistent headache and physiological issues. I would like you to address this with your PCP, your primary care physician. And next time when you come in, I would like us to discuss further and we can see if the strategies that we use worked. Does that sound like a plan?
Yes, that sounds like a good plan.
All right. Well, this brings us to the end of our interview today. I hope you implement what we discussed today, and I look forward to more sessions with you in the future, and I look forward to more positive outcome. Well, this concludes my integrative therapy video for today. Thank you for watching, and thank you for taking the time.